Hello, good morning, good afternoon, good evening. This is Dr. Alvin Marcelo. I'm the Executive Director of the Asia eHealth Information Network and a proponent of the Open Insurance Management Information System. The course was created to inculcate to students and faculty principles of health information management, and we wanted to share the importance of ethics, privacy, confidentiality, and security before actually going into a deep dive of health informatics. openIMIS collects sensitive personal information such as name, age, sex, ethnic origin, diagnosis and procedures, medications, and the health professionals responsible for the collection needs to understand the ethics involved in the management of such information. The principles of bioethics apply to the management of sensitive personal information. When we talk about ethics, we refer to four basic principles, and these would be familiar to you already from your course on bioethics. The first one is autonomy, which states that it respects the patient has autonomy of thought, intention, and action when making decisions regarding healthcare procedures. They should therefore be able to make decisions that are free from coercion or coaxing. To make a fully informed decision, the patient must understand all risks and benefits of the procedure and the likelihood of success. Autonomy is often manifested through the practice of collecting informed consent. The second is justice, which refers to the concept where the burdens and benefits of new or experimental treatments are distributed equally. In dealing with their patients, healthcare providers must consider four main areas when evaluating justice: fair distribution of scarce resources, competing needs, rights and obligations, and potential conflicts with established legislation. The third is beneficence, which refers to the concept where a procedure is offered to the patient with the intent of doing good. This requires healthcare providers to develop and maintain skills and knowledge that are continually updated through training, so they can offer adequate information to individuals in varying circumstances and strive for their net benefit. And the fourth one is non-maleficence, which refers to the concept that the procedure must not harm the patient or others. For example, vaccines are employed by governments under the assumption that they are doing no harm, or at least minimizing harm, by pursuing the greater good, such as the immunity for communicable diseases for the whole society. However, because a few individuals may have adverse reactions to vaccines, some could die or suffer significant morbidity. This principle requires the health professional to ensure that the treatment being offered does not put the patient in harm's way. To gain a better understanding of the concepts of privacy, confidentiality, and security, let us take a few steps back and look at the concentric model of data flow in healthcare. If you imagine a set of circles, concentric circles, you can place the patient or the person at the center of the circle, and that person has the right to keep information about himself or herself, and that will make that data private. However, in certain situations, a person may decide that some of his or her health data needs to be disclosed to a second party, perhaps a doctor or a nurse. The orange circle depicts that set of data which this private person has decided to disclose to a health professional, for example. The health provider then is the next concentric circle, the yellow one, because now, after the disclosure, the health provider knows something that used to be private data about a person. The health provider, as we were trained to do, would then create an artifact through documentation of that private data that was disclosed to us. So the green circle depicts the mechanisms that we as health professionals do to make sure that we can remember or take note of what was disclosed to us. This documentation sometimes are disclosed to third parties like insurance companies, like PhilHealth, like the Department of Health, or other regulatory agencies that require reports to be submitted to them. So if you imagine the data flow as a set of concentric circles, then this would be simple depiction of how data might flow from the private space of a patient's head, for example, to an agency like PhilHealth. Privacy, therefore, is the right of a person to keep data to himself. Privacy is a fundamental right, essential to autonomy and the protection of human dignity, serving as the foundation upon which many other human rights are built. Privacy enables us to create barriers and manage boundaries to protect ourselves from an unwarranted interference in our lives, which allows us to negotiate who we are and how we want to interact with the world around us. Privacy helps us establish boundaries to limit who has access to our bodies, places, and things, as well as our communications and our information. Confidentiality, on the other hand, in the context of health and social care, intrinsically means not disclosing information about a client to anyone who should not know or does not need to know. This is vital to protect the rights of client where appropriate, but health and social care workers and clients alike should bear in mind that a carer's duty to share information where required is of equal importance. Information security is the protection of information and information systems from unauthorized access, use, disclosure, disruption, modification, or destruction. Information security is achieved by ensuring the confidentiality, integrity, and availability of information. In healthcare, and for the purpose of this guide, confidentiality, integrity, and availability mean the following. For confidentiality, that the property of keeping electronic health information in openIMIS, for example, is not made available or disclosed to unauthorized persons or processes. For integrity, that the property of electronic health information has not been altered or destroyed in an unauthorized manner. And for availability, the property that electronic health information is accessible and usable upon demand by an authorized person. Lastly, let's talk about the four elements of a secure transaction between two parties, for example, a patient and a healthcare provider. In sequence, the important four elements are identification, which means the parties should be able to identify each other or have names, after which there should be authentication, that the name and the actor are actually matched, that there is no impersonification being done. The third is authorization, in which parties have autonomy or ownership of their part of the transaction. And the fourth component is non-repudiation, which means that parties cannot refute the transaction once made. These four elements are actually happening implicitly every time we interact with our patients, but we are not conscious about these four elements. However, in electronic health information systems, these four elements are fundamental and should be made part of the design of the electronic health information system, such as openIMIS. So I hope everyone will enjoy the rest of the day as you go through the technical aspects of openIMIS. We created this course to allow medical faculty, nursing faculty, and students to get their hands around an actual electronic medical record and insurance management information system so that they can start to critique our own national health information system and have a laboratory by which they can start working on experiments and studies. So I hope you enjoy the rest of the day, and please feel free to email me at alvin.marcelo@ahin.net if you have questions about this course or about this topic.